Good morning. I'd like to welcome you all to a day and a half of thinking and reflection on mechanisms for organizational behavior change to address the needs of people living with Alzheimer's disease and related dementias. Today really is about understanding how we apply various policy and other tools to drive changes in the delivery and support of people with living with dementia and their caregivers and families. I'd like to begin by first acknowledging the generous support of the National Institute on Aging in putting this event together. And I'd also like to thank the dedicated staff that really worked very hard on assembling everything you're going to hear about and engage with over the next day and a half. Crystal Bell, Cheryl Nass, Annalise Gonzalez, and Rakshana Gupta all just worked very, very hard to make all this happen. I chaired the planning committee, and it was a pleasure and an honor to do so. And you'll be hearing from various members of that committee throughout the next day and a half, as they will be either chairing sessions, moderating discussions, or actually presenting points of view. Terry Fulmer, Sharon Inouye, Julie Robeson, Faith Mitchell, Scott Halpern, and Elizabeth Belmont graciously gave an enormous amount of time and energy to putting this together. To get us going, I'd like to introduce two folks from the National Institute on Aging. We'll start off with some remarks by Melinda Kelly, who's the acting deputy director at NIA, and then we'll hear from Teresa Kim. Melinda?